Hola guys, happy Thursday? Wow, already? Happy Thursday. Oof, it's been a week, y'all. I'm trying to think where we left off on the updates. I think I was heading over to, I was gonna get my port, which I've gotten put in, hence the little seatbelt strap, which they gift you at the cancer center, along with little knit caps and pillows and all kinds of little handmade things. I think I mentioned that to you guys before, that they have volunteers that knit all these amazing little things and make all these amazing little things for the patients there, and this is one of them. It just goes over your seatbelt to offer some cushion to a newly implanted port. That went okay. My sister-in-law picked up my sister and then dropped us off at the hospital, and then picked us up, took us home, and my sister stayed with me for a few hours until Caleb came home, and then she went home. And the procedure itself, you guys, it was so freaking fast. They offered Xanax for something, and I said no because I was gonna have to drive, and I regretted it. So when they offered the Xanax this time, I'm like, yup, because I was already, very nervous. So they gave me Xanax, and I'm sitting there for like 20 minutes waiting for it to kick in before they were going to take me into the procedure room, fill me full of dope, and do the procedure. You guys, I don't remember crap past the Xanax. I remember taking the Xanax. I remember laying there being scared and praying and crying a little. And then I remember the surgeon coming in. I don't remember what he said. And I remember being taken into the procedure room. I remember being lifted from the little rolly bed onto the procedure table, and that's it. You guys, I don't remember crap else. I don't remember them administering the dope in my IV. I don't remember anything else. I just remember waking up and seeing the nurse near their bedside saying, "You did great. We're going to give you a little bit of recovery time, and then we'll go ahead and call your ride." I woke up and I felt no pain. I didn't even think to look at my chest until after I got home, because I was so out of it, guys. So friggin' out of it. Well, they wheeled us out to the car, so I didn't feel any kind of weirdness. I just, time to go home. So I felt very sleepy, very groggy, but I didn't feel off. It wasn't until we got home that I started trying to walk, and I realized I am not, I'm not walking well. I'm not walking well. My legs are like jello. And then I started to feel really dopey. Like, I felt really, really dopey. I fell asleep on the sofa because I woke myself up snoring. And my sister was there watching, I didn't eat lunch, guys. Watching the last season of Peaky Blinders. I remember turning on Peaky Blinders and then waking up, and she's still sitting in the same spot on the sofa watching Peaky Blinders. And then a little dude comes home. I don't remember my sister leaving. I don't remember making dinner, but apparently I did. The next day, I got up to go to work, and I felt terrible. My legs were still jello-y. I felt very, very off. Hi, guys. I felt like under the influence or something, and I'm like, I am not gonna drive like this. There is no friggin' way. I was nauseous. My head was hurting. I still had no pain. a tiny little bit of an ache, almost like a bruise or like a bad mosquito bite, but no pain. But I felt terrible, guys. So I stayed home. I called my boss and I told her. She goes, I figured as much. I didn't really think, you'd be able to make it in, but don't worry about it. You're fine. So I tried to sleep, and 5 times, guys, I don't remember it happening the night before, during the night, but when I laid back down to sleep, 5 times I woke up doing this. I couldn't breathe. And I'm like, dang, girl, you snoring that bad? Because I wake myself up snoring all the time. I snore, okay? But this was different. This didn't feel like I woke myself up snoring. This felt like I can't breathe. 5 times I woke up gasping. And I'm like, what the heck is going on? So around 10 o'clock, my phone rings. And it's my oncologist's office wanting to know how the procedure went. Just asking how I was doing, and I told them that it was okay. I ended up staying home a second day because I really feel under the influence of something. And she said, oh, okay. She said, well, we were just calling to check on you and also to schedule your chemo education visit. And I'm like, what? Every time I turn around, it's another friggin' appointment. And she's like, yes, could you come in on Thursday? And I'm like, no. I said, I've already missed Tuesday and today, and I have to miss most of Friday. I said, I can't keep missing work. I said, is there any way you could see me today since I'm off anyway? She said, well, I don't want you driving if you're feeling under the influence or you're not feeling well. I said, well, can you give me a few hours, to see if I feel better? And she goes, I'll give you until 1:30. If you don't feel well by 1 o'clock, just let me know and we'll have to reschedule. But we do need to get this class, this lesson going. I said, okay. So around 12, I get up and I'm feeling, my nausea's gone. I'm still feeling dopey, but my legs work. My legs are finally working. And I don't feel right. I feel like I've been through some things, right? But I'm like, it's just across the freeway. I'll be fine. Now, prior to my going to the appointment, she had called in 4 medications that she wants me to have on hand prior to my treatments. So that's the first trip I made. I went to the pharmacy. I went to the wrong pharmacy. Again, I should not have been driving. I went to the wrong pharmacy. And when I pulled in, I'm like, this ain't my pharmacy. So I made it to my pharmacy. I picked up all my meds. Get in the car, y'all. I passed the clinic. I don't pass the clinic once. I passed it twice. And I'm like, oh, I don't need to be driving. I feel confused. I'm not sure where I'm going. But I made it to the clinic. I walked in. That appointment turned into an appointment where I really needed to have been more focused. Like I was not in the right condition to have been at this appointment because there was a lot of information coming at me, and in my haze it didn't occur to me to turn my phone on to record, which I've been doing because I know me on a non-high day can't remember crap. I didn't turn my phone on, so I'm trying my best to listen to her, and I think she understood something a little off here, so she repeated herself a lot. She highlighted a lot of things. She wrote down a lot of things in my little binder in regards to the schedule, the types of medications, this and that, and I didn't come to find out they need to do more labs. The labs to check my white cell count before my first treatment. My first treatment is going to be October 10th is the first treatment, my first chemo appointment. So my veins are so over it at this point that the last few times that they've tried to draw blood, a couple things are happening. I get very woozy. I never used to get woozy, guys, when they drew blood. Never got woozy, never needed the juice after, never needed any of that. But the last now 3 times that they've drawn blood, I get really lightheaded. I get to feeling funny. I want to throw up. And it's not just the nerves. I think it's the blood draw. So, and my veins, my poor veins are just exhausted. So, the last 2 times, veins in both arms have collapsed. So they have to go in another route. During my procedure, the vein for my IV collapsed. So they had to put in right here. So when they told me they were going to have to draw more blood, I was like, oh gosh, this is not going to be good. And it wasn't. They had to stick me twice. And I was so tired, so sick, so out of it. I started to cry. Just from exhaustion, just from the pain of the needles, just from... I was overstimulated. It was too much coming at me. So they finally drew the labs, and the nurse navigator came out, who is so amazing. I swear, she's an angel on earth, man. She ain't got no wings. But she's the sweetest, most soft-spoken, amazing advocate for patients that clinic has. Just, I mean, she's a nurse navigator, so just amazing at what she does. And she asked me how my port site was, how I was feeling. I had mentioned to her that I was concerned about Caleb not, struggling once I start to look sick. And she looked into resources in regards to possibly being able to talk to an autistic child about what's happening. Because I'd already reached out to the school and let his counselors know this and this is what's going on. Right now he's acting really, really strong, but I want to have a buffer for him if, he starts to struggle. So the school is aware. And the nurse navigator is looking into some resources. They offer therapy there, but I'm counseling there, but more so for the patient than the families. But I thought it was amazing that she went that extra step and looked for autism support specifically. I was like, look at her. Look at her. So we're talking, and she saw the haircut. She said it was really cute. And she said, had I started looking into turbans or scarves. She says turbans are so much easier because they don't untie. And I said, no. I said I was thinking maybe wigs. And she says, well, wigs are expensive and hot. She said, I'm not trying to dissuade you or anything, but they're expensive and they get hot. And then sometimes your scalp will get tender with the chemo. She's like, so scarves, because they're they can get heavy when you tie them. They're kind of long. She goes, that can kind of put pressure on your scalp. She goes, so turbans, because they're soft and compact, they're small. She goes, they're a lot easier. And I'm like, okay, I'll look into that. She goes, well, come on. So she takes me into this room, and in the room they have these. They have pillows, they have the turbans, everything handmade, guys. Everything handmade by volunteers. So I got a few of those. And I'm ready. The port site looks okay. It's a little itchy. It's kind of like when you have a tattoo. I don't have any pain aside from a little itching. It's not uncomfortable, but I'm still very nervous and very scared. Thankfully, I haven't had any complications yet. I haven't had any weird sensations or feelings that a lot of people that have had this in there have described to me. Like when I turn my neck, I feel a pulling, or I feel a pinching in my chest, or I haven't had any of that. So hopefully it's been inserted correctly and it's a good, we're good. But sleeping is a little hard because y'all know this side is jacked up. So I am a left side sleeper. Well, now I'm not able to sleep on my left side or my right side, so I'm sleeping on my back. But at least stopped. That was freaky. And I was told when I was speaking to the oncologist nurse, I was told that that's an effect of the fentanyl. I was given fentanyl, guys. And one of my friends on YouTube or Facebook mentioned that they had some weird breathing issues when they were given fentanyl. And I told her, oh my gosh, I'm over here gasping for breath all friggin' night long. I wonder if it's linked. And yep, my nurse confirmed. That's one of the symptoms. It's one of the effects of fentanyl use. I'm like, well, that's wonderful. But it only happened that first night, guys. It hasn't happened again, thank goodness. Because I was scared to go to sleep. I'm like, it's a mess. But I can breathe well. I just can't sleep very comfortably. Getting out of bed is a trip. Getting out of bed is so friggin' hard because I can't leverage with this arm because it hurts. And I'm scared to push up on this arm because I don't want to pop a stitch. So getting up is a trip. I may have some abs by the time all of this is done because I do like a big sit up to try and get up. I have to bird bath. I can't take a full-on shower. So I have to bird bath, which just leaves me feeling gross. I can wash from my waist down, no problem, regular schmegular, but then I'm worried about the shower sprinkling on me. So I don't feel clean. I don't feel clean. But Friday I can take off the bandage. But what I'm gonna do, because I'm scared of screwing myself up, I'm just gonna take a full-on shower and let it come off by itself. I'm not really in any hurry to see it. Right now it's just the patch, so it's not real. I'm not ready to see it. I think it's all done with the exception. Oh, tomorrow I'm going to work for 2 hours and then I have to leave at 10 to be back on this side by 11:30 because I have an ETT, echo something, my heart test. I have that and then I'm done. That takes about an hour and a half, I'm told, and then I'm done. And it's Friday. So I'll be able to just relax and enjoy the weekend. I was told in the chemo I love these veggie straws. I was told in the chemo education thingy that for the duration of my chemo, I am not able to eat at buffets or have sushi. What kind of cruel mess is that? Because I'm going to be so susceptible to germs and stuff, I have to be very, very careful of what goes into my body. And she says buffets are not, there's too much risk because there's so many hands around the food and on the utensils and stuff. She goes, there's way too much risk. You're going to be very, very susceptible to infection, to sickness. So we don't want you to eat any salad buffets, any food buffets, no raw food, no sushi. I'm like, y'all know I eat my feelings, and y'all know I love me some buffet. So I told myself this weekend I'm gonna have a hoorah. I'm gonna go stuff my face at buffet, and I'm gonna go stuff my face with sushi. And it's going to be my going away foodie stuff. Y'all, I couldn't wait till the weekend. I came out of that clinic. Mind you, I'm over here like, I'm off fentanyl and Xanax still. Felt better. But I should have gone home. I was exhausted. I was tired. I didn't feel well. I was still a little nauseous. But I'm like, I'm not waiting until Saturday. I'm going to go have my buffet now. And I did. And my fortune, guys, my fortune reads, remember to seek joy in the everyday moments of life. And the fact that it says joy, was kind of cool because y'all remember that book that I found at the thrift store, Finding Joy Through the Ugly Cry or something like that? The one I told you that the author was a cancer survivor. When I tell you, as I'm reading parts of that book, especially the chapter where she describes and starts to talk about her cancer, it's dang near verbatim my diagnosis, the experience she's gone through with the tests and everything, the order of the tests and everything. I was like, it was like reading my medical records. I was like, whoa. And she stresses joy, joy, joy. The whole book is about joy, finding joy in everything. Even in chemo, finding joy in everything. So here is my little fortune talking about finding joy. So I'm like, okay, I think that's going to be my mantra word. My mantra word is going to be joy through the next few, however long, moments of my journey. My mantra word is going to be joy. But I ate, came home. It was Whopper Wednesday, so how am I gonna splurge on myself and I ain't got my baby his Whopper? So we went and got his Whopper, and when the smell of his burger filled my car, I almost had to pull over, guys. Maybe I ate too much. Maybe it was still the dope in my body. I don't know, but ooh, last night was rough. Last night was rough. Today, I came in, full day of work. Yay. I was training up front with the checkout crew, who's able to give me more time to train me on scheduling because they schedule. So I worked up there the whole day with them, and they're all really nice. They all guided me through here and there and here and there the way I had to. I was able to check out a few people, make a few appointments. And then towards the end of the day, I switched over to another little employee, and I was working the cancellation no-show list. And she is so full of energy, guys. She gave me a headache. She gave me a headache. Very friendly, very sweet, pretty darn good trainer, but very energetic. She made my head hurt. Just a lot of information. And it was a long day, but it was a good day. But I ain't gonna lie, I missed my little apartment, but it was a good day. I'm a little nervous. I'm telling you guys, I'm a little concerned that they don't know what to do with me. I think they may be trying to find a different spot for me. I don't know. Maybe I'm overthinking, but they're trying to keep me busy. They're trying to get me trained, and they're working very, very well with me. I appreciate that, but I think they're starting to realize what we can do with this one. At least that's me. That's what I'm thinking right now. The new guy starts tomorrow. Again, I'm only going to be there 2 hours, so I'm not really going to get to meet him much. But I got to do what I got to do. And as of right now, I haven't heard anything negative. I haven't heard any whispers behind my back. I am joking around about it. And I'm telling you, some people are like, should we laugh? Should we not? So apparently on Fridays, because it is October, every clinic in the hospital gets issued every year a brand new breast cancer awareness t-shirt. And they were talking about how we get to wear our cancer awareness t-shirts tomorrow, and this and that, this and that. And I just told the ladies in the front this morning about what I got going on. I felt they needed to know why I don't know as much as I probably should, or why they haven't been able to train me as well as they should have by now. And towards the end of the day, they're talking about how we need to wear cancer support t-shirts tomorrow, and I already wear my breast cancer awareness bracelet, and oh look, I have my breast cancer awareness earrings on, and I'm like, hey, I can outdo all of y'all. I have breast cancer. And I started laughing. I started guffawing, okay? I started laughing. And one of them's like, and the other one next to me, she's like, she's trying not to laugh. And I said, girl, it's okay for you to laugh. And she starts to laugh. She goes, well, if you're laughing, I said, honey, I have to laugh. I said, I laugh so I don't cry. And she said, then I'm laughing with you. So, but a lot of people are stunned that I can joke around about it. I told y'all about the tassel, right? The one tassel. You gotta find joy. You gotta find joy in even the bad stuff. And laughter is joy. You know, you gotta laugh, you gotta joke. I'm not making light of the situation, but it's my situation. I would never laugh at anybody else with this situation happening, but I'm laughing at my own. I'm joking and making light and trying to get through my experience with it in my way. But well, apparently tomorrow everybody's gonna be in pink. I know I have my breast cancer t-shirts from the past when I used to work there somewhere, but I'm not too concerned. I'm only gonna be there 2 hours, but that's what's been going on. Oh, let me tell y'all guys, this whole experience has had its what the heck moments. Let me tell y'all. And I meant to tell y'all this, but I kept forgetting. Y'all been with me a while. Y'all know if something weird's gonna happen, it's gonna happen to me, right? If it's rare, if it hardly happens, if it usually doesn't happen, trust me when I tell you, it's gonna happen to me. The day that they were gonna do the PET scan, I get there, that's the one where they put in the most radiation. Now this radiation comes in, I swear it looks like a hand grenade. It comes in this iron, I don't know, it comes in this heavy receptacle. It looks like a little hand grenade. It looks like a giant bullet. And of course, I'm not looking at you injecting me with this thing. I'm gonna look away. So they know I'm nervous. They've been doing it long enough to know when you have a scaredy pants in your presence. So the lady's over here gonna inject this stuff into my veins, and the other nurse is right here in front of me trying to make conversation, trying to distract me. So I'm talking to her about I don't know what. And all of a sudden I feel a splash. It came across me here, across onto my hand, where I had it setting on the arm of the chair. So, whoosh. And at the same time as when I felt that, the nurse I'm talking to goes, and I swear everything went in slow motion. And then she got splashed. So we got splashed. She goes, and I'm looking at her. And then I turned to look at the nurse over here, like, what the heck happened, right? I turned to look at the nurse over here, and she's like, there's liquid everywhere, guys. There's liquid on the little tray where she's handling this thing. There's liquid on the floor. There's liquid on us. And she's like, and then she looks at the other nurse, and the nurse looks at her, and I look at the nurse, and we're all kind of like looking at each other. She says, don't move. You guys, this is a whole situation. It was like a whole hazmat situation. The vial was this big, but apparently, because it was radioactive, there's a whole protocol, a whole cleanup protocol that has to take place. You guys, they had to put down this, looked like a big old giant diaper. They had to put down this fat diaper thing, tape off everywhere that had liquid on it. That we had to wipe down with these wipes, and then put on this foam wherever we had thought we had been splashed. We had to take off our clothes. They had to be put into little plastic baggies. We're walking around in gowns and in paper scrubs. Everything had to be in these little biohazard bags. Then this man called a radiation something officer had to come in and basically wand you down, like, to make sure you aren't radioactive. And I was like, the whole time I'm like, hold on a second, you guys all but assured me that the radiation in this injection was minute and that there was nothing for me to worry about. So now this thing busts open and it's a whole, friggin' movie in here. Like, the precautions and the cleaning and the shutting down of the trailer, because it's a mobile lab, mobile radiology. I'm like, what lies are y'all telling me? But it was a whole thing, guys, and it wasn't even 8 o'clock in the morning yet. So I'm like, are we gonna have to reschedule? They're like, no, we don't have to reschedule. We can't go they can't go anywhere now. The nurses can't go anywhere. The trailer ain't gonna be of any use, but they can still do the test. So they went ahead and got the other vial, and she was they injected it, and I did the test. But we still had to wait after the test for that officer, whatever the officer, the radiation, whatever, safety officer, RSO, radiation safety officer, came out and cleared us all to go on about our happy ways. So I came home in paper scrubbies, white paper scrubs, and they let me keep my underpants on because there hadn't been any real threat. Like, my underpants hadn't gotten wet, but my shirt and my pants and everything had. So I came home in white paper scrubs and little booties on my shoes with the instructions to take my little biohazard bag of my clothing, to leave it outside in the sun, leave it outside for the rest of the day, and then I could wash it the next day. But I had to be sure I didn't wash it with any other clothing. And then after I finished washing it, I had to run a cycle of the washer with just water and detergent. I'm like, but y'all telling me this stuff y'all injected in me is safe. Okay, but anywho, so that was a whole thing. And then after my procedure, when they woke me up and when they woke me up and told me that you did so good, the doctor in there, he's like, oh, and I want you to know that it is absolutely okay that you snored. I'm like, what? He's like, yep, 3 times you open your eyes and apologize for snoring. Okay, I don't remember. Then I told you guys I got home, right? And I couldn't remember crap. I make dinner, apparently. What did I make? I don't remember what I made. But I made dinner. And sat at the table with little dude. And apparently, guys, according to him, I had a whole conversation with a water bottle and a salt shaker. I was like, oh my God, you should have recorded it. He goes, you freaked me out. I wasn't thinking about recording anything. I said, baby, I'm sorry. Did I scare you? He said, well, you freaked me out a little bit. At first, I thought you were talking to me. But then I looked at you and you were looking down. I just thought you were sleeping. Or not feeling good because you were looking down at the table. But then you kept talking. And you were talking to the salt shaker and then to the water bottle. I was like, what was I saying? He goes, I don't know. He goes, it didn't make sense to me, but you were having a whole conversation with the salt shaker and the water bottle. I'm like, baby, I don't remember none of that. I said, what did I do after? He said nothing. He said we ate and you did me like this. Then that's my sign to give him kisses, because I don't go upstairs anymore. I sleep downstairs now. I've been sleeping downstairs, but before he goes to bed, I do, because I gotta give him his goodnight kisses. I ain't gonna stop doing that. He goes, I said, what'd I do after? He goes, nothing. He says, we ate. And then I went upstairs and you lay down on the couch. And then later on you did me the, and I went to bed and you went to your room. I don't remember none of that crap. None of it. I don't even remember giving my baby kisses. But at least I did. That I'm aware of. I've never had fentanyl before. I'll never want that crap again. I don't know if it was a fentanyl. I don't know if it was a Xanax. I don't know if it was a combo. But I never want that crap again. And to think that people use this recreationally. Like, they'll use it. They'll use it recreationally. Why? Why would you want to feel that way? It's a horrible feeling. And the fact that you're so out of it. The fact that I made dinner, guys. And this is freaky. I know I'm laughing about it. But the fact that I made dinner. The fact that I'm in the house with my child. The fact that I don't remember any of that. Oh my gosh. Like, no. That's scary. But it took a good 2 days for that mess to get out of me. My head still hurts. And like I don't know if it's because, like I said, it was just so much information and all the training today. Or if it's left over from the procedure. But I don't like that at all. But I wanted to update y'all. Give y'all the skinny on what's going on. Tomorrow is the scan. My one last not scan, my heart thingy. And that's it. That'll be it until the 10th, when my first radiation appointment is. And they've already told me that I'm gonna need a driver. Like, we're gonna pump you full of anti-nausea medication. We're gonna pump you full of steroids. We're gonna pump you full of everything we think you may need to get you through, so that your first experience isn't terrible. You know, your first visit isn't terrible. So you definitely need a ride home. We don't know how it's going to affect you. We don't want you driving home. The nausea medication that we give you makes people very, very drowsy. If you don't experience a lot of nausea, maybe we can not give it to you for your second visit, and then you can drive yourself home or to work. But for the first visit, we don't want to take any risks. We don't want you to be super miserable, so we're going to pump you full of meds. Get a ride. So I'm like, well, I don't want to go through the fiasco I went through last time of putting everybody out, and everybody's requesting days off, and here and there and here and there, and then at the last minute, you know, everything switched up. I don't want to put anybody out like that. So I got to figure that out. I got to figure out. And they don't need to stay with me. They just need to be able to drive me home. So I need to figure that out. I have until the 10th. And I know the people that were as ready to help me the first time will be ready to help me again. It's just, I got to get used to asking for the help. And my friend's husband told me that they were going to be so mad at me if there was ever anything I needed. And I didn't ask them. So I'm like, I better not make them mad. I got between now and the 10th to figure it out. Well, between now and, I say the 8th, to figure it out. I definitely got to give people a heads up. But I plan on taking the whole day off that day. That may be part of why my head is hurting. I'm getting a little nervous. Granted, I have the FMLA to buffer the days that I'm off. So I know my job is safe. But I don't have the PTO that I need to cover all of these days. And then, you guys, my son, with the government shutdown, is out of work. And he helps. You know, he's never not helped. I mean, I'm good now, but it's just a little nerve-wracking. I'm trying not to think about it. He's already said, Mom, don't worry about it. My finances are good. If I can still continue to help, even during the shutdown. But I'm trying not to think about that. But I think subconsciously I am, because my head friggin' hurts. Why does my head hurt? Oh, you guys, I want to thank y'all, because I don't thank y'all enough. And I especially want to thank y'all now, because some of you guys are asking about GoFundMe's and all that, and we've already discussed that. That would be the last ditch effort. I would never want to ask for that. But one of you guys made a comment to all of you. Like, one cyber sissy reached out to all you cyber sissies. It's in one of the videos for you guys to watch the ads, because it pays me. And you guys, y'all have heard me thank you guys before, because of the revenue that comes through these videos. And it has always come in handy, and it will definitely come in handy now. And I'm not gonna sit here and ask y'all, watch all the ads, guys, because one of you awesome friggin' cyber sissies already asked that. I just want to put it out there. Thank y'all, really, thank y'all. Thank y'all for those that understand how YouTube works. It took me about a year to figure out how it works. Thank you for those of you that sit through the ads. I really don't know how it works, but I know it works. I don't know how many views, I don't know how many, I don't know how it works, but I know it works, because for a time now I've been a little extra every month because of you guys, and I really appreciate it. And that's not why I do YouTube. I didn't even know that that's what YouTube did. Even when I became a partner, when they started putting ads on my videos, I didn't really understand what's that, until one of my friends said, "Fool, you mean to tell me you ain't checked your little account?" And there was money in there. So now I'm aware. But I never went on here with the intention of making money off of anybody. But just the fact that you guys are sitting through the ads to help, I think y'all are so freaking awesome for that. Because it's so easy to hit skip. It's so easy to hit skip on some videos when you want to get to the nitty gritty of things. But I appreciate, whether you watch the ads or not, guys, whether you watch the ads or not, I appreciate y'all just being here. I love hanging out with y'all. I love talking with y'all. I love sharing all my business with y'all. I appreciate y'all so much. But I just wanted to put that out there, that if you all are intentionally sitting through the ads to help a girl out, y'all are so sweet. I appreciate y'all so much, because y'all don't have to do that. But I do appreciate y'all. Every last one, y'all. But anywho, that's the update. That's what's going on. But I'm good, y'all. I'm in a good place. I'm going to stay in a good place. I got God. I got family. I got y'all. I'm good. So, I'm going to focus on this drive. Get my hiney home. And make dinner in my right mind. So, until my next go round, I love y'all bunches. Bye.